Hi, I'm Dr. Margaret Schlosser. I'm an optometrist with Fraser Eye, and welcome to A Day in the Life. So a typical day for me starts around 6 o'clock is when my alarm goes off. I work out every morning for about 30 minutes, and then I come back up, get ready. I feed my dog some breakfast, and then I pack my lunch, have a quick breakfast. I usually have a cheese stick, a yogurt, and a protein shake for lunch. And for breakfast, typically just a quick protein bar, and that's it. Some water all day. So today is just a normal clinic day, seeing patients all day. I'll have a good mix of just some routine care, some glasses prescriptions. I usually get a couple of add-ons for red eyes, maybe like a foreign body, something to take out inside of the eye. But yeah, you never really know what to expect or what I'm gonna get when I get in there, and that's kind of the fun part of the day, just you never really know what to expect.
How are you?
Hi.
How are you? Yeah.
Okay. Good morning. Good morning. Good morning. All our good mornings. Back to the office. So morning starts, I come in, go to the back office, say hi to Dr. Barton, always, right?
Hello.
And then go through the patients for the day and just kind of get a feel for what we are dealing with. So on my patient list, I can see what the patients are scheduled for, and I'll just kind of go through their charts if I need to prep for anyone. I have some eye pressure checks for glaucoma, got some refractions to do, a couple of post-ops. So I'm a medical optometrist, and what that means is that I see a wide range of typically surgical and a lot of medically focused patients. We do routine care here too as well, but we do have a focus on a lot of surgical and medically necessary patients. All right, so it looks like our first patient of the day is ready. Let's go check it out. So I have a post-op that I'm gonna see, a patient that had cataract surgery done. He is at the finish line, so everything should be healed. We're gonna update a glasses prescription for him if he needs it and just see how he looks. Right this way. So I'm just adding some notes into the chart, just about what I saw when I examined the patient. This helps me record what I saw at the time so that when he comes back in for a follow-up, I know right where I left off. Okay, so we are going in to just see a routine exam today. Patient's in for her annual exam. I'll get started with her, check her eye alignment, check her pupils, and then I'll update her glasses prescription. Then we'll get her dilated, send her over to Dr. Barton, and he'll finish up. So let's see how she's doing. While you watch. Have a good one. All right, so she was just in for a routine exam today. Just her annual appointment. We're checking on her cataracts, making sure her macular degeneration looks stable. I did prescribe her a new pair of glasses, which helped to fine-tune the vision a little bit. And then Dr. Barton finished up her exam to make sure everything inside of the eyes looks good, which it was very stable. So she was doing well. So this is how we keep track of patients, the ones that we've seen, the ones that are left to see. I like to break it up into AM and PM. All right, so we are about to go in to see a 90-year-old patient who is here for a follow-up. She had a Fresnel lens placed on her glasses, and this helps to keep the eyes well aligned. It's a type of prism that we use. So I'm basically checking to see if that worked for her. It's a little sticker prism that goes on her glasses. And if it worked well, I'll recheck the measurements. We'll go in and I will prescribe it in a pair of glasses for her. All right, so let's check out and see how she's doing. Okay, so she was doing actually really well. The Fresnel prism worked really well. So in the video before, you can see where the little lines are on her lens. That's the sticker prism that I used to trial and see how she was doing. Turns out that worked really well to keep her very well aligned. She had no double vision issues with that sticker on. So I rechecked her alignment, I rechecked her glasses prescription, and we ended up prescribing her a new pair of glasses with the prism included, which will keep everything lined up for her. She was really happy. All right, so it was a good day in the clinic again. We had a good mix of patients. I saw some eye pressure checks, some post-op patients, some routine care, a lot of refractions. And that's probably the thing I like the best about clinic is you never really know what you're gonna expect. I come in, I look through the schedule to kind of get an idea of what's gonna come in, but you really don't know what you're gonna get until you meet the patient in the chair. And I like that challenge of just kind of having to adapt and think on your feet and go with it. So another good day. Thanks for joining me on a day in the life of a medical optometrist with Fraser Eye.